Hi there, my name is Dr. Brad Deacon. I'm coming to you from Burlington Spinal Decompression. So we're going to talk about scoliosis today. Scoliosis is very, very misunderstood. There's a difference between scoliosis and something called a lateral curvature. We're going to explain that, but we're going to explain why it happens. Now, we're first going to talk about scoliosis. Now, as you know, the spine is supposed to be straight from front to back. So this is the pelvis here. We want to make sure that what are called the iliac crests, or your pelvic crests, are at the same level between the right and the left-hand side. And we want to make sure that when the pelvis is level, the spine, the lumbar spine, comes out of it at a perpendicular 90-degree angle. Now, most scoliosis happens actually in the lumbar spine, in the kind of the mid-thoracic area. It's not too much in the upper thoracic area, and very, very infrequently in the neck, although it does happen, but it mostly happens in the lower 2/3 of the spine. Now, again, a scoliosis is what we call a curvature in the spine like this, but a scoliosis is different from a lateral curvature in that a scoliosis, not only does it bend sideways, it also has what we call vertebral rotation. So the vertebra actually start to spin either one way or the other. So these parts right here, these bumps right here, they're supposed to be in the middle of the vertebra, and when they start to rotate, that's a true scoliosis. That's different from what is called a lateral curvature, where there's no rotation of the vertebra. Now, both of these respond extremely well to non-surgical spinal decompression. We're very, very skilled at this. In fact, the table that we have actually deals specifically with things like this. So not only can we get the pressure off the discs, we can actually do what's called unwinding of the scoliosis. We can put you in something called a mirror image, and we can actually unwind your spine and get it back more towards normal. And when we stimulate the nervous system in the mirror image posture, it helps teach the brain to keep it central. So we can basically unwind scoliosis. So it's extremely important because we reteach the brain to keep it central in the middle and untwisted. So that's really, really important because scoliosis is considered progressive. It tends to get worse and worse and worse over time. And it can actually end up leading to compression fracture as we age and our bone density decreases. Now, again, a lateral curvature is just a sideways bend. A scoliosis is a sideways bend with rotation. Now, there's two reasons why it happens. There's one thing called a functional scoliosis, which just means it's kind of bent and twisted for no real reason. And then there's something called a structural scoliosis, with something called a hemivertebra. Hemi means half. So instead of having a block-like vertebra, you'll have kind of a pie-shaped vertebra. And as a result, if it's kind of pie-shaped, meaning triangular like that, the vertebra will actually have to go like that. But what happens over time is the top part of the spine goes in the opposite direction to end up trying to keep your eyes level. So we are very, very good at helping scoliosis. We're extremely good at helping lateral curvatures, both with spinal decompression and the neurological and structural work we do. We are considered the best. Many other doctors come to train through us. If you'd like to learn more about scoliosis, lateral curvature, and what non-surgical spinal decompression can do for you, please visit us online. It's burlingtonspinaldecompression.ca. Thank you.